to our second episode of Ignite MD. So we're basically just a platform that connects with local doctors, and we offer a platform for high schoolers to gain insight on the life of a doctor, the day-to-day activities of various fields and stuff like that. So we're here with Dr. Shah. And so if you could give a little backstory.
I was, I guess, born and raised in Chicago. I went to medical school there, and then ended up going to UAB, so University of Alabama, Birmingham, for my orthopedic surgery residency. During med school, I took a year off and did a sports medicine research fellowship at the Mayo Clinic. So from Chicago to Rochester, Minnesota to Birmingham, Alabama, trained under Dr. James Anders. People who know sports medicine may recognize that name. While I was in Alabama, and then went to Houston for my sports medicine fellowship, where I trained under Dr. Walt Lowe, who takes care of the Texans and Rockets, and then also his partners who take care of the Astros and the Dynamo. And then when I finished my fellowship in 2015, came here to Dallas and started working here.
Very cool. So we'll just get started. So what initially drew you to like sports medicine as a career?
Yeah, so I actually love sports. I always loved sports growing up, but I always sucked at them. So in middle school, I played every sport and tried out for every sport. And in middle school, it's a no-cut policy, right? So every kid makes the team, right? Then you hit high school, and then now it's all about who can play and who can't play, right? So every tryout I went to my freshman year, and didn't make any freshman team. Couldn't make not even equipment manager. I had no talent for playing sports. So I figured, I got a brain. I got a good brain. I do well in school, so I might as well become a doctor and then be able to take care of those who can play, and be part of the team that way. So that was kind of one of my motivations. Yeah,
that's really cool.
Yeah.
So do you envision? I mean, I guess you've worked with professional athletes. Like that's where you began your medical training experience. So was that an opportunity that you had in sight as you began this whole process, or was it something that just happened later on?
Yeah, I think everything's in evolution, right? I kind of wanted to do something in sports medicine growing up. Like I said, I played sports, but I couldn't play sports because I wasn't good enough to make it. So I always thought I'd become a doctor and then help that team out that way. But then as you get, into medical school, you start learning about other specialties, you start considering other specialties. So everything's a journey. It's not so cut and dry. I knew in high school that I wanted to be a doctor.
Yeah.
And I thought, I could be a sports medicine professional at some point, And then you go through medical school and you learn about, medical subspecialties, internal medicine, pediatrics, OBGYN. Although OBGYN is more of a surgical specialty as well too. And then you learn about surgical specialties, right? There's neurosurgery, ENT, plastic surgery, orthopedic surgery, right? So you go and you keep an open mind and see what else you want to do. But I did computer engineering in undergrad, and I loved my engineering kind of classes. And so, for me, those experiences just kind of solidified orthopedics, because orthopedics is very mechanical, right? It's the only specialty in medicine that deals with how the body moves, right? Bones and joints are what make bones, joints, and then obviously the muscles are what make your body move, right? And that's kind of what orthopedic surgeons deal with. And so it was the most mechanical, or the most engineering-like part of all that. So my interest in sports growing up and doing engineering in undergrad, kind of combining all those things and knowing that orthopedic surgery kind of combines all those, that's kind of where that all evolved. And then you go through orthopedic surgery training and you go through all the subspecialties. I was drawn to spine. At one point, I did some research with a spine surgeon at my medical school, Rush Medical College in Chicago. And so that kind of got me into spine a little bit. So I was thinking maybe sports and spine, and if there was a way to combine the two. But ultimately, I think at the end of the day, for me, sports was it, and sports medicine, orthopedic sports medicine was kind of where my passion and my interests really lie. So that's what drew me to that and kind of took me that way.
Yeah, cool. Yeah, I actually want to do biomedical engineering too. So I feel like it's another stone to so many other opportunities that
Exactly.
Yeah. So did you ever envision that you would end up working with professional athletes?
Well, yeah. So I mean, I think as you go into sports medicine deeper and deeper, obviously the pinnacle is to work with professional athletes, right? And so I mean, I think I always wanted to. And then when you go into fellowship, it's kind of where you choose to do your fellowship, you can determine which teams you're going to work with, right? There's a fellowship at Michigan, so you're going to work with all the University of Michigan teams, right? And then there's a fellowship, where at Harvard you work with, the Patriots and the Boston Red Sox, and that kind of thing. So like, you know, you can kind of choose where you want to go and work with them, but it's not really like in fellowship, you're still under somebody else, right? And so you're still working under them. And then you kind of see what it's like at the highest levels. And then your goal is to like, hey, I want to work my way up. Right. You know, as you get out, now you're fresh. You're like, okay, you're not in training anymore. There's nobody looking over your shoulder. You're working on your own. And so at that point, you're like, all right, well, I'm going to work my way up. And so, you know, like, I'm sure there's people tell you that, oh, you always got to have goals, right? Yeah. You got to have like a 5-year plan, a 10-year plan, right? Like what you want to do. So my 5 and 10-year plans were like, hey, like my 5-year plan was get a bunch of high schools, right? Yeah. My 10-year plan was, hey, I wanted to have a D1 school that I'm helping take care of. And then towards the end of that 10 years, like I want to make sure we have a professional team that I'm taking care of.
So that's pretty cool.
Yeah.
So I guess that's like your sort of journey to like working with these, you know, NFL, NBA, MLB teams. So what's the biggest difference between, I'm assuming now you don't work with them anymore, or do you?
Yeah, so I hit my 5 and 10-year plans. Right. So I'm part of the team that takes care of FC Dallas. Okay. Right. That's my professional team right now. I also help take care of Fortis MMA, which is like all the UFC fighters, and then they have some boxers and stuff too that have crossed over into some of their MMA fighters have crossed over into boxing. So take care of professional, you know, basically MMA fighters or boxers, and then also help take care of professional soccer currently. And then I have, you know, I'm part of the team that takes care of TCU. And then we also take care of UT Dallas, which is going Division II. Right. Yeah. And then we also help take care of Dallas Baptist University, which is a Division I baseball program. So, you know, I hit my goals that way by taking care of those. And then I have, you know, 5-6 different local high schools that I help take care of as well too. So. Okay.
So do you have any like special memorable cases from like any of these that you'd be willing to share?
Yeah, I mean, I think I can share even the names because it's out there in the public record. So when we were taking care of the Texans, Jadeveon Clowney was a rookie, and he had injured his knee, and so that was definitely a memorable case. You know, there was also another NFL athlete, which I don't know if this is published or not, but he tore his pectoral muscle, and so I operated on him and we fixed his pec. And then that same year, you know, one of their players, I think it's out there so I can say it. But their quarterback broke their tibia and fibula in the game, you know. So, you know, I was there in all 3 of those surgeries. I was part of, you know. I was an assistant surgeon or a fellow surgeon, if you will, kind of helping taking care of those athletes. I wasn't the main surgeon of record, but I was in there. I did those surgeries. You know, I performed and I assisted them with those surgeries. Yeah.
Of course, like the experience has definitely been memorable enough. So, what was like the game day experience like? Obviously you were present during those times,
so again, like you're an assistant team physician, right? You're not the head, so the guy that goes out there is the head team physician, right? But the cool thing about having a good mentor like Dr. Walter Lowe is, you know, he goes by Walt, but having a mentor like Walt is, you know, he's going to involve you in all the decisions and keep you apprised of what's going on, so you kind of learn from it, you know. Like he was an excellent mentor, excellent teacher. And so even though I'm not the one making the decisions, he's telling me what's going on. He's keeping me in the loop of what's going on. It's part of the reason why I picked that fellowship too, was because, you know, when we interviewed there, they took us to each of the facilities, right? And each trainer that was there, the head athletic trainer or the head of sports medicine that was with each team told us that, hey, we're going to get your cell phone number day one. And when there's something that happens to an athlete, like we're going to call you and we're going to make you, you know, you're going to be intimately involved in their care, you know? Whereas other places didn't necessarily have, like, you didn't get that feel on the interview, that on the interview day that they had that level of engagement. And so, so you're part of it, but you're not making the decisions on the field, right? Now, you know, obviously now that I'm out of training and have been in practice for almost 10 years now, with FC Dallas, if I'm the person that's covering that day, if I'm the orthopedic surgeon, that's like the first, you know, first in line, then I'm making the decisions that day, right? Of what happens. So, you know, it's, I don't know if that's your question, if that answers it or not.
So, I mean, I guess that makes sense. Like, what would it be, like, I guess now you're in, you know, that sort of head position, if you're in that head position, then how do you deal with, like, the different factors of, you know, obviously you're probably weren't trained to deal with.
And so it's a progression, right? Like you've seen how your mentor did it when they were in that situation, right? And then I think at the end of the day, you gotta trust your knowledge, you gotta trust your training, you gotta trust you know, what you have, all the skills that you've developed, right? And so I think like a lot of times with professional sports, it's kind of like the decision making is like, is this emergent or not, right? Do we hold this player out or not? And you know, as things shift and knowledge grows, you know, things kind of move to protocol-based stuff, right? Like as we learn more and more, it kind of becomes more of like, well, do they have this, this, and this? Well, then that's a concussion, right? And so we need to pull the player out and reevaluate them, right? And to continue to reassess them, right? And so I think that's, you have kind of your checks and balances that you kind of use as you go through your training. And that guides and helps your decision making, but a lot of times you have a neck injury or a head injury, and your biggest thing is, well, how do you clear, can you clear C-spine or not, right? And you have a certain questions, and you have a certain physical exam that you apply, and you help that guy, and it guides your decision making on the whether, hey, all right, we need to call for the ambulance, we need to call for the EMT people, and we need to spine board this person because I'm worried about a suspected spinal injury, right? So, yeah.
So, you're talking about like the physical examination and like, the different factors you have to include. So what unique challenges are faced specifically, outside of like just evaluation, but more surgical aspects? So what challenges would you face in I wouldn't say the operating room, but I would say like leading up to like, the surgery?
I'm not sure I understand your question.
I feel like, how do I explain this? So what unique challenges do you face when performing the surgeries, particularly for athletes with, a high physical demand?
Yeah, I would say it's not very challenging at all. Okay. Like I tell my patients all the time, like whether you're a professional athlete or a weekend warrior or Joe Schmo sitting on the couch, like I'm gonna do the surgery the exact same way, right? The steps are the exact same way. And so to me, that's not really a factor in my opinion, because I try to do the surgeries the same way. I think in a country like America, we have great access to care. Everybody can get the same surgery. So that's not really the difference between the two. So it's not really like the decision making doesn't go into it. I can see how a lot of people might be a little bit more nervous or more on edge if they were to operate on a professional athlete, because there is a lot more at stake. Yeah. But for me, it's like it's the same steps whether you're a professional athlete or regular person off the street. Like I'm doing it the same way.
That makes sense. Yeah. So what role does like sports medicine specifically play, and especially with athletes who are recovering, to prevent those injuries from happening again? So what are like some steps and maybe stuff you do to ensure that they don't maybe get injured?
So a lot of things kind of rely on your own personal, like just like with playing sports, right? If you've taken the shot 1,000 times, then you know that you're gonna most likely make it in a game, right? And so preventing injury a lot of times has to do with the proper training, right? So we implemented a program, and I do that with all my high schools now, is that so the year we got there, we were looking at ACL injuries in various different sports, right? There are programs out there called sports metrics or FIFA 11 that help train the muscles around the knee, and they help decrease the rate of ACL injuries, right? So you implement programs like that with your teams, and you get to hopefully decrease and prevent some of those injuries, right? So we had a volleyball team. So there's nothing for volleyball. There's FIFA 11 for soccer. There's sports metrics for basketball and some of the other sports that are out there. And then so we said, why don't if you look at all the ACL injuries in volleyball, most of them happen because the ball's up in the air. They're either trying to block it at some awkward angle or try to spike it at some awkward angle, and then they land on one foot when they're off balance, and then their knee buckles, right? So then that causes an ACL or some sort of ligament tear, right? So we thought, what if we just taught them to land on both feet, right? So we went we created a program where we taught volleyball players to make sure they can go up at any angle, hit it at any angle, but when you come down on 2 feet, right? And we went from, the typical like 10 to 15% ACL tear rate, in any major team to 0% the next year, right? After we implemented that. Yeah. Again, 0% is probably going to be an anomalous year. You're never going to get it at 0, but it just so happened that the year after we implemented that, there was none on any of the teams that we were covering that actually did the program, right? I see. So, things like that. When knowing the anatomy, knowing the way the injury happens, you're able to help out, by preventing as well.
I see. So just moving on to like a question on collaboration. So I'm assuming that, when you're training these athletes, you're probably going to be working with like physical trainers and other maybe, multidisciplinary teams. So how do you collaborate with other professionals in this field?
So usually there's a hierarchy, like in any team, there's always an athletic trainer. Right. They're usually the first responders, to athletic or sports injuries. Right. So, something happens on a field, the person you see running out there with the bag or with all their equipment, that's the athletic trainer. Okay. they'll usually assess first. And then if it's something beyond their capability of handling, or if they need some higher level decision making, you'll usually see them look back either over their shoulders or look to the sideline. And when a player gets injured, usually the doctor will come, walk over and be in the line of sight for the athletic trainer. Right. So that when the athletic trainer looks at him, I mean, with a look, you can give 1,000 different messages, right? But usually they give the look and they know to come over, right? And so you start making your way over. And then we also have, most professional athletic events have a sports medicine or a medical huddle. So at the beginning of it, we say, all right, look, if someone goes like this, that means, we need everybody, we need everybody to come out, or this is like a heart issue, this is a head issue. If we go like this, that means we need everybody. Like something major, seriously wrong, everybody get out here, right? So we'll have a huddle, we'll talk about it, everyone will know, hey, EMS is going to be over there. So, the paramedics and the ambulance will be over there. Or they'll tell us, hey, actually, you know what? EMS, the paramedics will be over there, but the ambulance is coming from over here. So when you need EMS, we'll signal them. And then, if we need the ambulance, we'll give a different signal. So depending on the venue, where you're at, where all the medical teams are actually going to be doing stuff. So there's a whole logistical component to coordinating that care. And so those are some of the things that we do. So yes, we definitely work in a multidisciplinary team. We have meetings, we have huddles, we make sure that everything's kind of taken care of so that if there were to be a serious injury, we could be in the best position to give the best care possible.
All right, so starting back where we left off, we were going through a collaboration with multidisciplinary teams, so like the team that you work with. And we were wondering if, we've already gone through patient stories, right, where you get NFL athletes with the Houston Texans. Actually, I've known many people who've written college essays on that same person you treated, so it's like a very circle moment. And so have you worked with any athletes who inspired you through their determination and perseverance during recovery?
Yeah, I mean, so I worked with Dr. James Andrews when he had operated on Adrian Peterson, and so like when we did his rehab, it was just amazing. Like, we were, you'd go and talk to the therapist, and normally, like, most people don't want to move their knee after knee surgery, right? After having an ACL, it's a brutal surgery. It hurts a lot. And so, the therapists are starting to prepare him, right? So they're like, hey, listen, Adrian, like, you're not going to be able to move your leg like you're used to. It's going to hurt a lot. You're not going to be able to you're not used to the way it's going to feel and be. And so he would just be like, what, like this? I'm not supposed to be able to move it like this? Where are we at? So normally, like, the first step is like, hey, let's get full range of motion. He's already demonstrating, like, oh, look, I got full range of motion, And so he was just way beyond his like, I guess physical makeup, genetics, whatever you want to call it, and pain tolerance was beyond like normal, right? And so day one, he was already past anything else. So you're just like, man, that's just crazy, So, but yeah, I think like, I had another athlete, a UFC athlete, and we published an article on him, so I can mention it too. His name is Kennedy Nzechukwu. He's the African Savage in the UFC, and so, his story itself is incredibly inspiring. So his mother at the time had ALS. She obviously since has passed away. He has an autistic brother, that he has, so he's taking care of them, and he's the sole breadwinner in his family, right? So he's literally fighting for his family, right. Fighting to survive for his family. Which is a pretty cool story, right? And so he tears his ACL in training, and then comes to me, and so we fix his ACL, and we get him back to fighting, and then, he won his next 3 fights after his surgery. Wow. But just going through the rehab process with him, you could tell, like, there's just a different level of motivation because of all the things, like, this is his profession, right? Mm-hmm. But it's not only his profession, he's doing it to support his family, and he's literally fighting for his family, which is kind of a cool story. So obviously anybody wants to learn or know more about that story is out there as well too.
That's awesome. Yeah. That's actually really cool that you guys go through those stories.
Yeah, and like, when you see him in the octagon, or fighting for the UFC, I mean, he's literally a savage. Like, I mean, but like every time he'd come into the office, the nicest guy, says hello to everybody, waits and talks to anybody. If somebody's a UFC fan, they recognize him. Mm-hmm. They come up to him, he takes all the time that they need. I mean, literally just would go by, say hello, say thank you to everybody in the office, say thank you to his therapist. Like every single, just the most humble, nice, kindest guy. You'd think, like, when you see him, you're kind of like, man, this guy's like I want to say he's like 6'6", maybe, wow. 250 pounds of all muscle. Maybe not 250 because I think he's a light heavyweight. So maybe like 230, 225, 230, but like solid muscle, like 0%, 2 or 3% body fat. you'd be scared of him. But then the way he goes around, he's like just like a big teddy bear. He's just a lovable guy, very personable, says hi, hello to everybody, asks them where they're from, gets to know them on a personal level, like just like the nicest guy. You never think that he just goes into the octagon and destroys people for a living. Like just based on his demeanor. So again, everything about him was just very inspiring, and how he went through his rehab and got back to his professional sport.
Yeah, that's awesome, because rehab's probably the most important part of recovery.
Yeah.
Not just the months after, but like the right after the surgery.
It's tough.
It's tough. So the way people persevere, it's amazing.
Yeah.
And is there any technology that new or has transformed throughout the years has helped with those recovery months and rehab, and also surgery?
I don't know about technology. I mean, I think with surgery, there's some new technology that's coming out. A very smart surgeon from Harvard named Martha Murray came up with the BEAR procedure. It's called BEAR, Bridge Enhanced ACL Repair. It's obviously very new. I'm starting to use it a lot more in people, and so I think as time goes on, we'll kind of get an idea of how to use it, when to use it. But it's a technique that allows you to repair your own ACL, right? So why not do that? Right now, the gold standard is to reconstruct it, right? So, that's a new technology that's out there. But I would just say as time went on, if you look at the evolution, let's just talk about ACLs in general, right? First, it was you used to do an ACL reconstruction, and then you put them in a cast and hold them out straight, right? And then everybody was stiff, and it was really bad, right? So now we know, hey, for a joint, motion is lotion, right? So we always say motion is lotion. So it helps lubricate the joint and keeps things moving. So you want to keep things moving. Now, there's always a balance, right? If you've repaired something, or if you've tried to fix something, if you start moving it too soon, it may not heal, right? So there's this balance. Then over time, we've learned exactly what the function of the ACL is. It's really just to keep things stable. And so if you're walking in a straight line, or if you're just moving your knee like this, you're not stressing your ACL out anymore, right? So we went from putting people in a cast and keeping them straight to saying, okay, well, if all we did was the ACL reconstruction, then hey, let's start moving it right away so that we can get that motion lotion going, right? And we can get and then so now the recovery has sped up because of that, right? Now, obviously, this has taken decades to get, like when I'm talking about putting people in the cast, I mean, we're talking the 80s. Right? When people used to do the surgery in the 80s. And that's why most people in the 80s didn't get it done, right? Or even in the 70s, people didn't get it done, because if you kept it straight, you got really stiff. And if you got really stiff, chances are you didn't get back to playing your sports because you had way too much scar tissue there to do. To where now we're in the 2020s, and we're making people move like right away, right? And again, like most people you hear, he had an ACL surgery, he sat out a year, and now he's back playing professional sports again, right? So, I think it's more of just, there's some technology component to it, and there are things that have come about that have helped. I feel like in the rehab space, when you're talking about after surgery, it's more of, understanding and knowledge of the body and knowledge of surgery and what happens after surgery has helped us kind of accelerate the rehab more. There are technological advances, but there's studies out there that say that they work and studies out there that say that they don't. But I would say more of our knowledge of anatomy and knowledge of biology has kind of helped us more with the rehab process. And obviously, there's tons of technology, like just going from doing the ACL surgery open, to now doing it with a scope. With smaller incisions, makes it faster. So in surgery, I feel like the technology has helped a lot more. But in rehab, it's kind of more understanding the body and the biology.
Yeah. And knowledge is power. It's driving everything.
Exactly. Yeah.
So, we're gonna go back in time, and when you were in medical school. Okay. So, doctors have an all-time burnout rate. It's getting higher as we go through the 21st century. Yeah. Because I've heard all kinds of stories where, I've practiced my whole life to do pre-med, and now somehow I don't want to be a doctor anymore. Mm-hmm. And so, what would you tell people who are trying to get into sports medicine or even any field of medicine to keep pushing themselves and to keep motivating themselves and others around them, their peers? So what would you tell them?
I would just tell them that you gotta make sure you love it. I mean, I think if you love what you do, you'll never work a day in your life. I love what I do. I love taking care of athletes. I love connecting with athletes. I love learning about who they are, where they come from, what their background is. And so, a lot of people will say, well, you're a surgeon, like all you want to do is be in surgery. No, I like clinic too, because that's where I connect with my patients, right? That's where I get to connect with these athletes and get to know who they are as a person. And I think that helps me treat them better as a doctor when I know who they are, how their mentality is. And then obviously the surgery, like I said, no matter who you do, if you got to fix an ACL, you're fixing an ACL, right? But then it's like, okay, now, when you know them really well, you can find ways to motivate them to help them get their rehab to go either faster or to get better or to get past a hump that they're having trouble getting over, right? And so to me, like, I love what I do, and I feel like I never work a day in my life. So the main thing is just choose something that you really love to do. If you don't love to do medicine, if you're doing it for what you think is the money or what you think is prestige or social status or something like that, then you're definitely going to burn out. But if you love what you do, I don't think you'll ever burn out.
That's awesome advice.
Yeah.
And going off of that, there are certain qualities that the field of medicine really favors. What do you think those qualities are, and how people who are going into medicine can build those qualities?
It's funny. I was actually talking to my son about this the other day. I don't know if this is particular to medicine, but the cheat code to life is two things: hard work and attention to detail. If you're down to work hard and put work your backside off, and you pay attention to very, very small little details and get them right and do things the right way, I think you'll be successful in no matter what it is that you do. Whether it's business, whether it's a service, thing that you're doing, whether it's medicine, whether it's engineering, and I think you can ask anybody in their field, like, does your job require hard work and attention to detail? And I think everybody will say yes. So I don't know that it's specific to medicine. I think, unfortunately, in our society or in I guess the world today, because it's everywhere, it's not just American culture. Like any country you ask, medicine, you got to be able to pass a test, right? And you got to score high on that test, right? So the specific things to medicine is being able to put a lot of knowledge about the human body, biology, and all that stuff into your head, and being able to recall that on a moment's notice on a test. Does that make you a good doctor or not? I don't necessarily know. I think you can learn that stuff. You can learn how to become a doctor without being a really great test taker, and there are plenty of examples of that. But unfortunately, the system, the way it is now, makes it so that you got to be able to memorize a high volume of information regarding biology, anatomy, physiology, and all the medical subjects, and retain that and hang on to it, and then recall it when you need to on a test. So I would say that's probably one of the things that's specific to medicine. But at the end of the day, I would say focus. Even that, right? Like, it's hard work, right? Like, you got to put in the work to memorize this stuff, right? And then you got to have attention to detail to be able to recall it whenever you need to, however you want to. So to me, the cheat code still applies, right? Hard work and attention to detail.
That's awesome.
Yeah.
I've actually never heard it like that, where attention to detail.
Yeah.
I've always heard hard work, dedication, but that's like what's going to keep you dedicated, what's going to keep you motivated. So, and it goes back to doing what you love.
Yeah, I guess I lump dedication, sacrifice, all that stuff to hard work, right? Because it's like you're putting in, when you have a choice to make, right? Like, if this is your chosen field, right? But then there's like a birthday party or somebody's graduation party or something else, but you could do something here, right? That's where the sacrifice comes in. So if you're willing to work hard, you'll say, you know what? I'll go see that guy later after his party. I'll go give him a card, or I'll say, hey, let's hang out when I have time. But right now, I got to dedicate myself to my field and bettering myself in that field. So I'm going to do that. I think, again, to me, that all falls under the hard work part of it. Yeah.
Speaking of these concepts where people it's important, right, for life in general, what are the most valuable lessons you've learned from your experiences in medical school or even college?
Yeah, I don't want to repeat it, but same thing. Yeah. Hard work and attention to detail are probably the two biggest lessons. We talked about it earlier too, like, love what you do. If you love what you do, you never work a day in your life. Those are all. I think, like, I know a lot. I'm sure what you're alluding to with the burnout stuff. I know a lot of people that aren't really happy being doctors. And I'm not going to speculate because I'm not in their heads, right? I don't know if it's because they didn't love it, or did they go into it because of the money, what they thought was going to be a lot of money. If you think about it, I've had people that finished undergraduate education the same time I did. They were making six figures. They're making hundreds of thousands of dollars. And it took me 10 years to get to the point where I got a doctor's salary, which is a decent salary, right? So $100,000 over 10 years is $1 million. You take that and you invest it in the market, and you add inflation, and you add everything else. I'm never going to catch up with them. So don't do medicine for the money, right? Now, if you think about it, everyone's got Google. Dr. Google is out there, right? WebMD is out there, right? So most patients come in knowing what they have and what they need, right? Whether they're right or not, I don't know. That's up to the doctor usually decides it. But at the same time, the prestige or that high status in life isn't really there, right? And so that's why I tell people, like, do what you love. Find what it is that you love. Find what it is that you're passionate about, and you'll never work a day in your life. And again, you'll make money off of it because you're so passionate about it that you're going to be one of the best at it. You know what I'm saying? So, I mean, I don't want to kind of keep repeating the same stuff, but I think those are my 3 main lessons that I've kind of learned. I guess one other lesson, if I wanted to add to that, so it's not like I'm repeating the same thing, I would say just, patience. Be patient. Things may not happen on your time. If you want a patient to get ready, get ready, get back to being at sports at a certain time frame because they have something coming, you could give it all your effort. They could give it all their effort. And sometimes it just doesn't work out that way, right? A lot of different reasons for why they don't hit the milestones at the time that they do. But, I feel like patience is also an extremely important quality, important virtue that you need for medicine as well, too.
Yeah, I agree. And reflecting on your career and legacy that you want to forward to your next generation of doctors, right? If you could go back in time, we were talking about this conceptual ideas the younger generation must have.
Yeah.
Specifically in your circumstances, whichever they were, what advice would you give your teenager self? Did you know you wanted to become a doctor?
Yeah, growing up, I grew up in the 80s. I was a teenager in the 90s. I don't know how well this is going to go over, but, growing up as an Indian kid in America, or really an Indian kid anywhere, forget America, parents like, you're going to be an engineer or a doctor, right? So it's kind of like ingrained in my head that I was going to be a doctor. And I don't know if that's brainwashing or not, but what I did in undergraduate was I chose to do an engineering degree, right? And then because I figured if I don't get into med school, I should have a good backup. And I enjoyed engineering. I enjoyed the mechanical aspects of stuff, right? And I kind of made sure I got experiences into both. And when I was working at the help desk at my university and fixing computers and going around the campus and putting stuff together and fixing things for professors when things would break apart, or if they needed a specialty sort of job for whatever presentation that they were going to do, doing all that, it was fine, it was fun, I was happy to help, but it wasn't like, I didn't feel like this is what I want to do for the rest of my life, right? But then I would volunteer at a hospital, and every time I go into the hospital, I'd be like, man, this is where I belong, and so that kind of more solidified it for me as like, yes, now I know I want to be a doctor, Yeah, sure, growing up, I was like, oh yeah, your kid's smart, he's doing good in school, he's going to be a doctor or an engineer, and he's Indian, so he's going to be a doctor or an engineer, right? And so for me, like, it was really those experiences in my life that told me that no, this is where I belong, and this is the path that I should pursue, and that's what kind of solidified it for me in undergrad.
Yeah, and going back to, you chose computer engineering as a major, and that was also something you were interested in, but you didn't see yourself doing that for the rest of your life, right? And
as I got it, initially, I thought if I don't get into med school, I have a good backup. And what I really enjoyed was like the hardware aspects. So, I had a small little business in high school where me and my buddies, we learned how to put computers together. And, back then in the late 80s, early 90s, Gateway computers was huge, right? Like the Gateway 2000. And those things cost $3,000 at the time, right? And so we figured out that we could basically get the same parts separately and put together a $3,000 computer for $1,000. And we could sell it for $2,000, make 100% profit, and make it cheaper for everybody else, and they'd get the same quality stuff, right? So we made a small business out of it. So I loved the hardware aspect of it. And so that's kind of what I focused on when I was doing my, so when you do an engineering degree, as you get into your 3rd and 4th years, you have to pick electives, right? So all my tech electives were all in the hardware, and the other thing I loved was networking. So it was right when Warcraft, not World of Warcraft, I'm talking Warcraft, the first one, Warcraft and Warcraft 2, those first 2 were coming out, right, in the early 90s. And so I just was mind blown by how my computer sitting here in Chicago, Illinois, could network, I could play a game with 5 or 6 other, we'll play Warcraft with 5 or 6 other people around the world. And the computer, the game knew exactly where everyone was and where their maps and their troops were, and then we could fight against each other. That was mind blowing to me. So I wanted to learn how exactly that happened. So hardware and networking, those were kind of my 2 really main passions. But I did a lot of that. I did what the work was in undergrad, I wouldn't say I did it. I experienced it. I gave myself experiences into what that world would look like. And it didn't really feel like something that I was that passionate about, or that I felt like, oh yeah, this is what I want to do for the rest of my life. And so for me, that's where, again, the experiences in the hospital kind of was like, drove me toward medicine.
And people in college, they believe like if you take like a pre-med class like biology and then go to medicine, they're like, oh, I'll have a better advantage than everyone else, and I'll be more prepared. And then something happens and they don't want to be a doctor anymore. That's a fallback on a biology degree, right? Mm-hmm. So, would you recommend choosing something that you could fall back on and have a pretty decent, or your target of a decent salary or career if you don't make your plan A?
Yeah, I mean, I would say pick things you're passionate about. At the end of the day, it just goes back to that, mm-hmm. right? Because I feel like, even if that field may not make a lot of money, if you're the best person in that field, people are going to come to you and you're going to be able to find a way to make money, right? So I wouldn't worry about the salary aspect or like that aspect. I would find stuff that you're passionate about. And people can be passionate about multiple things that are completely opposite to each other, right? Like engineering and medicine. I mean, yes, they mix, and there is a biomedical engineering, right? Yeah. Like you could do that. But it didn't necessarily mix. But my advice would be to find things that you're passionate about. And again, to me, it was it boiled down to like the cheat code, right? Like work hard. So computer engineering and medicine don't necessarily have a lot of overlap, mm-hmm. right? So I didn't take less than 17 credit hours any semester of my college, and I wanted to finish in 4. That was just one of my goals. Was like, I'm not going to stay in college more than 4 years. And so most people in engineering degrees finish in 5 years. But I didn't take less than 17 credit hours. And most of my semesters were 20, 21, 22 credit hours. The lowest one, I think there was one summer. And I took a summer semester. Like I did not go to school. Like even signed up for the summer semester, which are usually abbreviated classes. And they're like, you're taking 17 credit hours over the summer? You're crazy. And I was like, yeah, but engineering and computer engineering and medicine are not overlapping. So I'm going to have to take these classes in order to finish my goal, which was 4 years, and then go to med school, hopefully, at that time, And so I think that's where it comes in, is just find something that you're passionate about, and go into that. If you're talking about admissions, honestly, for medical school, if you do something different and something else, you're going to stand out. Because majority of the people are doing biology, psychology, some sort of medical field, right? I think even biomedical is getting up there now. Yeah. It's still less because nobody wants to do all the work that it takes to get an engineering degree. But still, more and more people are doing biomedical engineering with the hopes of doing doing medical school. So I feel like even that's growing. But if you have a passion in a completely opposite field, it's gonna set you apart from everybody else, but also it's gonna make you a more well-rounded person, right? And admissions counselors and people who are running medical schools know this. And the more well-rounded a person is, the more easily they are able to relate to their patients, right? And the better doctors they make eventually. So my advice, if you're asking for me, what would your advice be? My advice would be, follow your passion, especially if you have a passion that's something different or completely outside of medicine, right? Because then that will help round you out, help round out your personality.
Yeah, that's actually great advice. Yeah. I think that a lot of people will find that useful because I know we're juniors, and next year we're going to start deciding what majors we want to do, what colleges we're applying to, and so that's a very important aspect of the career, right? And
I hope so.
What do you hope your legacy will be within the field of sports medicine? So looking back and looking forward.
I'm not a big, when it comes to legacy and things like that, I don't really think too much about it. I think I prefer to be in the moment. I think if in this moment I'm the best that I can be, and then in the next moment I try to be better than whatever it was, right? Because I know I'm not perfect, right? Nobody's perfect. Everybody's got flaws. Everybody's got things that they can work on. And so at the end of the day, I think if you kind of day by day, hour by, week by week, month by month, and just try to make yourself continue to get better, I think legacy is the stuff that people will figure out when I'm gone, right? And then they'll look back and say, well, he was a good doctor, he was a good sports medicine guy, or, he took care of me and, whatever else, and helped me and my family out. So I'm not big on legacy from that standpoint. I'm just more about, hey, be in the moment, do the best you can now, and then look back on it and say, well, how could I have done better? When this situation comes up at me again, what can I do differently, or what can I do better? To make it a better outcome, or even do the surgery more efficiently, faster. And we talk about, it's not about faster like getting it done faster when we talk about surgery, right? You just don't want to leave the human body open that long, right? So the faster and more efficient you can make your hands, the faster and more efficient you can make each of your steps, the better it's going to be for your patient recovery-wise, right? So we're always trying to make surgeries faster, quicker, and better recovery, right? Like minimally invasive, smaller incisions. How do I use a smaller incision for this? What if I do a smaller incision? What difficulties am I running into in moving on to the next step? And so how do I overcome those and keep the incision smaller? Or do I need to make it slightly bigger and then make it a little easier and make the surgery faster, right? So these are all different things that you can do as a surgeon to try to make it, make yourself better.
Mm-hmm. And surgery, it's very complicated field, and people, there's a thing, physician versus surgeon, right? And so people choose physicians because they like the more caring aspect. People choose surgeons because it's the more mechanical, it's the more intricate field where you have to actually go into people's bodies. You have to know, like, basically in all anatomy of the humans. Like, so is there like a mix where you can be as caring, you can be caring, but you still want to be a surgeon? Like, how important is the aspects of being so mechanical and intricate as a surgeon compared to being?
I think. I don't know what it is. I mean, you're not wrong. Mm-hmm. There's definitely, when you get to medical school and then you start to get into your clinical rotations, you'll see there's a medicine, mm-hmm. and then there's surgery, right? Yeah. And so medicine is kind of much more cerebral, a lot of thinking, mm-hmm. a lot of trying to figure out what's wrong and then how we can treat it and that kind of thing. And surgery is more of like, here's the problem, let me go fix it. Okay. And so you kind of figure out what mentality you are from that aspect. As I kind of mentioned it earlier, like for me, the caring aspect can come in both, right? Like I care about my patients. I spend time with them when I'm getting to know them as I'm diagnosing their injury and developing a treatment plan for them. I love that part of it. I love clinic. I love getting to know my patients. I love getting to know their families. I love getting to know what they're into, what type of stuff that they find interesting, and what are their hobbies, what are they really into. And so to me, that aspect of it kind of comes if you are that type of person, right, where you care and you want to do that. So I think you can bring that into any field, whether it be the medicine side of things or the surgical side of things. It's just a matter of what, and there are other people out there that are just like, no, I'm just looking at surgery. I'm trying to figure out whether this patient needs surgery or not, and then if they need surgery, am I the person to do that surgery or not? And hey, to each his own, right? I mean, if that's your approach to medicine, if that's your approach to being a surgeon, there's nothing wrong with that either, right? Some people are like, I've heard many times, like, he may not have the best bedside manner, but he's the best surgeon, so that's where I'm going to him. And that's cool too. Like, there's nothing wrong with that. But for me, I think you can bring the caring aspect into any part of medicine, because it's we're here to help people, right? We're here to help people get better. We're here to help them get their health better, right? In whatever subspecialty or whatever field that you're in. And so I don't think you can't say that surgery doesn't have a caring aspect to it, right? Like you can bring caring into whatever you want to do, for sure.
Yeah, I think that's one of the most important qualities of a doctor, being caring, because stepping into your patient's shoes.
Yeah, I agree, 100%.
One last question: if you could leave, if you left medicine today, what would you how would you go about the rest of your career?
I guess I'm not really understanding your question, because I feel like for me, if I left medicine, that would be the end of my career. So then now I'm changing careers and doing something else. But if I was done, the way I guess I'll take it is, if I was done being a surgeon, what would I do? And I think if I was done being a surgeon, I think I'd go into some form of education, because I feel like now that you ask about legacy, or when you asked about legacy earlier, I think this is where it comes into is, if you can take what you've learned, if you can take what you've grown, what you've done in your career, and make other people better for it through education, then I think that's a long-lasting legacy, right? So in that way, I don't really care about my name. I don't really care about what people look at me as a person. But if I can take what I've used, even though I'm assuming that I'm stopping surgery because I've had some sort of injury, or that I've gotten old enough to where my hands don't work and I can't do surgery that well, right? But I can take my experiences and share them with the next generation of surgeons, with the next group of surgeons that are coming up, right? And so I think for me, education would then be the next, the next step after not being able to perform surgery anymore.
And
that's kind of the way I'm taking it.
And teaching people, it's as important as just being the person, because
I agree.
Medical school professors, most of the time they're either a doctor and a professor, or they used to be a doctor and they're a professor. And so keeping that cycle going where you're just giving off your experiences to the
100%.
to the student is just really important.
Yep.
Well, thank you for your time.
No
It was
problem.
amazing to hear your stories, your insight, and your experiences.
Well, thank you for doing this. Thanks for having me. I consider it an honor that you guys chose me to do this interview. So I'm happy to do it and honored that you guys asked me to do it. So thank you guys.
Thank you.
Yep, no problem.